What is the primary goal of mental health nursing? Promote mental health and well being. The primary goal of mental health nursing is to assist individuals in achieving optimal mental health and well being. This involves therapeutic communication, emotional support, and evidence based interventions. Which of the following is a key characteristic of mental health? Ability to form relationships. Mental health is characterized by the ability to form healthy relationships, adapt to stress, and contribute productively to society. It is not defined by the absence of stress or physical illness. What is the most important skill for a mental health nurse? Effective communication. Effective communication is essential for building a trust, understanding patient needs, and providing therapeutic interventions in mental health nursing. Which of the following is not a role of mental health nurse? Prescribing medications. Mental health nurses do not prescribe medications unless they are advanced practice nurse practitioners. They focus on advocacy, education, and implementing care plans. Mental health nursing includes care for which types of disorders? Mental, emotional, and behavioral disorders. Mental health nursing involves caring for individuals with mental, emotional, and behavioral disorders, aiming to improve their psychological and social functioning. What is the cornerstone of therapeutic communication in mental health nursing? Active listening. Active listening involves fully focusing on and understanding the patient's verbal and non-verbal communication, building trust and rapport. Which of the following is a fundamental principle in mental health nursing? Confidentiality. Confidentiality is crucial in mental health nursing to protect patient privacy and build trust in the therapeutic relationship. Which professional organization oversees mental health nursing globally? International Council of Nurses (ICN) provides guidelines, resources, and support for nursing practices worldwide, including mental health nursing. Which of the following is an example of a psychotherapeutic intervention used in mental health nursing? CBT, cognitive behavioral therapy, is a psychotherapeutic intervention that helps patient recognize and change negative thought patterns. Mental health nurses often assist in implementing CBT techniques, which is not considered a basic need according to Maslow's hierarchy relevant to mental health nursing. Financial success. Financial success is not a fundamental human need in Maslow's hierarchy. Basic needs include physiological needs, safety, love, esteem, and self actualization. What is the primary focus of mental health nursing care? Symptom relief and holistic care. Mental health nursing focuses on symptom relief, therapeutic relationships, and holistic care, addressing psychological, physical, and social aspects. Which term describes a patient's ability to cope with stress and bounce back from adversity. Resilience. Resilience refers to an individual's capacity to recover from difficulties and adapt to challenging situations, a key aspect of mental health. The therapeutic relationship between a nurse and a mental health patient is based on mutual respect and boundaries. A therapeutic relationship is professional and focuses on mutual respect, clear boundaries, and the patient's needs and goals. Which type of prevention focuses on reducing the impact of an ongoing mental illness? Tertiary prevention aims to minimize the long term effects of mental illness and improve the patient's quality of life through rehabilitation and support. Mental health nursing became an official specialty in which country, in which century? 19th century. Mental health nursing gained recognition and as a specialty in the 19th century with the establishment of psychiatric hospitals and specialized nursing education programs. Which of the following models emphasizes the interaction between biological, psychological, and social factors and mental health? Biopsychosocial model. The biopsychosocial model considers mental health as the result of interactions between biological, psychological, and social factors, promoting a holistic approach to care. The term mental hygiene was the first introduced by Clifford Bees. Clifford Bees introduced the